Stop. Don't click away. While we're busy admiring the feats of regimental surgeons, one unglamorous job with the title sanitary inspector changes everything you thought you knew about war. A water point matters more than a dressing station. A line for the bathhouse saves more lives than a scalpel, and one order about latrines can decide an entire campaign. Watch to the end to see how dirt killed armies faster than bullets, and who stopped it. Picture a typical military camp in the early 20th century. Tents in neat rows, a field kitchen under an awning with a pot of porridge steaming away, latrine pits covered with tarps, and a cramped line at the one and only water point. There are no operating rooms here, no surgeons with instruments, no medics carrying stretchers. And yet it's right here, in this line, in the crush around the pot, next to those pits, the unit's combat readiness gets decided. Because war doesn't kill only with bullets and shells. Sometimes it kills with dirt, water, lice, and hands that didn't get washed in time. The Spanish-American War of 1898 left numbers like this. Out of 306,800 American soldiers, 2,446 died in combat, and 5,438 died of disease. So disease took twice as many people as Spanish bullets did. In World War I, the Russian army sent 15,300 soldiers to the rear with infectious diseases in just the first months of the war: typhoid fever, epidemic typhus, dysentery, cholera, smallpox. These aren't random episodes, they're a systemic failure. The question is simple. Can you control this invisible front the same way headquarters plans attacks and troop movements? Can you cut losses from dysentery and typhus with an order, not just with prayer? And who exactly should take that on? The regimental doctor, already overwhelmed with surgeries and dressings, or someone else? This story is about how armies had to legalize cleanliness, how water, latrines, bathhouses, and kitchens turned into official duties, and hygiene itself became a profession with officers' shoulder boards, and why that required special people. Uniformed hygienists whose job wasn't to treat the wounded, but to prevent disease before it even started. When people talk about military hygiene, they often imagine a moral lecture about washing your hands and staying neat. In reality, it's risk management, very concrete risk management. A hygiene officer, or sanitary inspector, has 5 major areas of responsibility: water, food, troop housing, sanitation of the area, and oversight of soldiers' personal hygiene. Each one is a place where an army can lose combat power without a single shot fired. Water isn't just about thirst. It becomes a source of typhoid and dysentery if it comes from a well contaminated by runoff or dead animals. Food isn't about taste. It's about salmonella, flies in the kitchen, and poisoning that can drop a company overnight. Housing isn't about comfort. It's about how many people are packed into a tent or dugout, ventilation, dampness, and conditions that spread respiratory infections and parasites. Sanitation is waste removal, trash, carcasses, controlling rats and flies that carry pathogens. Personal hygiene is lice that spread epidemic typhus, and frostbite caused by filthy wet boots and the inability to dry underwear in time. A military hygienist is a doctor who spends most of his time not treating anyone. He walks the camp, checks water points, looks at how the latrines are set up, monitors how the field bathhouse runs, makes sure trash pits get covered on time, and that kitchen cauldrons get washed when they should. His work looks boring and invisible until an epidemic starts. Then it becomes clear he'd been fighting for the unit's health every day. It's just that his war was fought with buckets, shovels, and orders about where the tents go. The idea that cleanliness and hygiene matter in the military has been around for a long time. In the early modern period and throughout the 19th century, Army doctors already wrote manuals explaining that camps should be set on higher ground, water should come from flowing sources, and waste should be buried. The advice was sensible. The problem wasn't ignorance. It was that this knowledge stayed a recommendation, not an order. A military doctor back then didn't have the authority to make a commander move a camp or assign men to dig latrines. There wasn't a separate service focused only on prevention. There wasn't a stable chain of control that could monitor sanitary conditions from regiment all the way up to the army. Hygiene existed as a set of practices, but not as an institution. Logistics mattered too. Even if a commander understood the value of a bathhouse or clean water, finding the resources, transport, and time during a march or a siege was hard. So hygiene got pushed off until later, until an epidemic hit, and then it was too late. So the real question isn't whether people in the past understood that dirt was dangerous. They did. The question is different. What has to happen for an army to think about baths and latrines as systematically as it thinks about ammo and hardtack? The turning point came when wars changed in scale. Mass conscription armies of the late 19th and early 20th centuries became many times larger. Hundreds of thousands of people were in camps, trenches, and positions at the same time. Crowding increased, units stayed in one place longer, and logistics became more complex. In these conditions, the sanitary price of mistakes shot up. In an 18th century army, a few dozen typhus cases might be a local issue. In a 20th century army, the same infection could knock an entire division out within a week. An outbreak in camps spread faster than traditional methods. Isolating and treating the sick could stop it. At the same time, it became obvious there weren't enough doctors for everything. A regimental doctor had to operate on the wounded, treat the sick, examine recruits, and handle paperwork. Add daily checks of water quality, latrine conditions, kitchen hygiene, lice control, and it's physically impossible. Specialization was needed. People were needed for whom prevention wasn't an extra duty, but the main job. That's when the idea appears. Create a separate institution of prevention officers, people who do sanitation as a profession, not instead of doctors, but alongside them with different tasks. In 1917, when the United States entered World War I, the American Army ran into two problems at once: a shortage of doctors and the need to set up huge training camps. The solution was unconventional. Create a sanitary corps made up of officers who didn't necessarily have medical degrees, but did have specialized training in sanitation, engineering, bacteriology, epidemiology, and related preventive sciences. These people didn't treat patients. Their job was different. They were responsible for infrastructure medicine, water supply and purification, building and supervising latrines, waste removal, organizing camps from a hygiene standpoint, and fighting disease carriers, flies, rats, mosquitoes, lice. Sanitary Corps officers worked with engineering units and the quartermaster service, but had enough medical training to understand epidemiological risks. A clear division of roles emerged. Engineering units provided the technical means, laid pipes, built treatment facilities, dug wells. The Sanitary Corps handled water quality, making sure it was safe, checking purification systems, and setting water use rules. The quartermaster service supplied food, while sanitary officers monitored how it was stored, cooked, and distributed. This was an attempt to turn prevention from a set of tips into a management system. Sanitary Corps officers held ranks, reported through medical leadership, but worked at the intersection of medicine, engineering, and command. They could demand changes in troop placement, camp organization, and supply routines if needed to prevent epidemics. How well it worked in practice is a more complicated question. The system was new, and a lot depended on specific people, available resources, and whether commanders understood why sanitary requirements mattered. But the very creation of such a service meant prevention stopped being the personal initiative of one doctor and became an institutional task of the Army. Let's picture a specific scenario. A division sets up camp for a few weeks. 10,000 people. Everyone needs water for drinking, cooking, washing. Every day, those people produce tons of waste: feces, trash, food scraps, carcasses from slaughtered livestock. If they drink from a nearest stream and dump waste next to the camp, dysentery starts within a week and typhoid follows within 2. The sanitary officer has to organize a water point. That's not just a well or a barrel. It's a place where water is checked for safety, chlorinated or boiled, and where soldiers are forbidden to take water from other sources. Engineers provide the water. The sanitary service guarantees its quality. The split may sound formal, but it's critical. An engineer can handle the technical side, but doesn't know which bacteriological tests are needed or how to interpret the results. Now, latrines. In the field, these are pits fenced off with tarps or boards. If the pit sits uphill from the water point, runoff contaminates groundwater. If it isn't covered in time, flies carry pathogens to the kitchen. If soldiers relieve themselves wherever they want because the latrine is far away or filthy, the camp turns into an infection source. The sanitary officer controls where latrines go, what condition they're in, how they're cleaned and disinfected. He makes sure trash pits are regularly covered with soil, food waste is disposed of properly, and carcasses aren't left baking in the sun. This is work you don't notice as long as everything goes fine. But ignore these rules once, and within days the hospital is overflowing with soldiers who have fever and diarrhea. The limits of the system are obvious, too. Even the best procedures break down when troops move fast, when resources are short, or when combat conditions don't allow you to stop and build a camp by the book. A sanitary officer can demand things, but if the commander decides that a march matters more than a bathhouse, prevention gets postponed. And then the risk comes right back. In the Soviet Union during the Great Patriotic War, the sanitary situation was critical. Million-man armies, the rapid retreats of the first months, destroyed infrastructure, and huge flows of refugees. All of it created perfect conditions for epidemics. In 1942, the position of front and Army-level sanitary inspector, hygienist, was introduced. This wasn't just a new job title. It was an attempt to build a controllable prevention chain of command. Hygienist inspectors worked at the level of the front, army, and division. They were responsible for 5 directions: troop nutrition, water supply, housing, sanitation of territory, and oversight of soldiers' personal hygiene. Each direction had specific tasks: checking food quality, inspecting kitchens, organizing water chlorination, placing units according to sanitary standards, setting up bathhouses and disinfection chambers, fighting lice infestations. Why did it matter? Because sanitation stopped being the concern of one doctor per regiment. It became a managed task at the Army and front level. Reporting appeared. Plans appeared. Named responsible officers appeared. If sickness rates started rising in a unit, a sanitary inspector could investigate, find a cause: bad water, a dirty kitchen, lack of bathing facilities, and demand corrections. The system wasn't perfect. Documents show structure and tasks, but real execution depended on many factors: supply, commanders' understanding of prevention, and whether people and resources could be spared in wartime. But the fact that hygienic support became a formal service with positions, authority, and management levels marked a real shift. Cleanliness started turning from a moral appeal into an official duty. The results can be judged by statistics. In the Great Patriotic War, infectious diseases made up only 9% of overall morbidity. For a war of that scale, in those conditions, that was a major success for the sanitary service. When people talk about military hygiene, they usually picture something abstract. In reality, It's very concrete things that directly shape combat readiness. Take the bathhouse. A soldier who sits in a trench for weeks can't wash. Lice live on his body and in the folds of his clothes. Lice spread epidemic typhus, a disease that killed tens of thousands in World War I. The sanitary inspector, hygienist, had to organize bathhouses and disinfection chambers. The soldier washes, and his clothes are treated with steam or chemicals to kill the lice. This isn't about comfort. It's about preventing an epidemic. During the Great Patriotic War, preventing pediculosis and epidemic typhus was one of the hygiene service's key tasks. Frostbite is another example. In winter trenches, soldiers stood for hours in wet felt boots or leather boots. Wet, cold footwear, dirty socks, no way to dry your feet. This led to frostbite and gangrene. Preventing frostbite was part of the sanitary inspector's duties, making sure soldiers changed socks in time, dried footwear, and treated their feet. It sounds minor, but at the front, minor things decide whether someone can go in a battle or ends up in a hospital. But here's the main question. What happens if the service exists, instructions are written, and a commander decides there's no time for bathhouses because the unit has to prepare for an offensive? What if prevention needs time, people, and resources, but the mission needs them right now? That conflict always existed, and it's what determined how effective the hygiene service really was. Picture this. A sanitary inspector reports to a division commander. The camp water is contaminated. You need to change the intake point, organize chlorination, and assign men to dig new latrines. The commander answers, I've got a march tomorrow. No people, no time, handle it yourselves. What happens next? Prevention means interfering with schedules, movement routes, bivouac sites, and supply. A sanitary officer can demand the camp be moved, the timetable changed, transport assigned to deliver water. But his authority depends on how willing the command is to back him. Documents, regulations, and instructions show how things are supposed to work. They lay out tasks, responsibility zones, and coordination rules. But they don't always show the real degree of enforcement. Could a sanitary inspector force a commander to comply if it clashed with a combat mission? Or could he only report upward and hope for support? Sources often leave this blurry. Most likely, a lot depended on specific people, the sanitary officer's authority, the commander's understanding of risk, and the Army's overall culture. In some places, requirements were followed. In others, they were ignored. That's exactly why the system tried to resolve the conflict not only through authority, but through formalization. If sanitary requirements are written into regulations, if hygiene is part of military discipline, then it's no longer a doctor's request. It's an order that must be carried out just like any other. The climax of this story comes when hygiene stops being a recommendation and becomes a regulation. Modern military regulations, both Russian and Western, state directly, a service member is required to follow rules of personal and public hygiene. This isn't advice. It's part of military order, as mandatory as following commands or wearing the uniform. What does that change? It changes the language used to talk about cleanliness. Before, a doctor could ask, explain, persuade. Now hygiene is a discipline category. If a soldier doesn't wash, doesn't change underwear, doesn't keep his living area in order, that's a violation of regulations. If a commander doesn't organize bathing, doesn't control the kitchen, doesn't ensure water supply, that's a violation too. Regulations give the sanitary officer firm ground. He can demand compliance not in his own name, but in the name of the regulations. He can report violations as disciplinary offenses, not personal disagreements with a commander. That makes prevention more resistant to pressure from circumstances. But there's still a limit. Regulations help you demand standards, but they don't replace water, bathhouses, or proper supply. If there are no resources, if the unit is on the move, if there's a battle, the regulations won't conjure a pipeline or build a bathhouse. Making it by regulation is necessary, but not enough. For prevention to work, you need rules, infrastructure, discipline, and understanding at every level. Still, the fact that cleanliness was written into regulations marks a final recognition. Sanitation isn't a bit of a millage. It's not some domestic detail and not a private matter for one doctor. It's part of military power, as important as ammunition supply or communications between units. Now let's honestly examine the main claim you often hear in stories about military hygiene. Hygienists saved more soldiers than surgeons. It sounds dramatic, but how true is it? Start with what documents confirm. Prevention really does reduce non-combat losses. In the Spanish-American War, disease killed twice as many as combat did. In World War I, the Russian army lost tens of thousands to typhus and dysentery. In the Great Patriotic War, the share of infectious disease was reduced to 9% thanks to the sanitary service. Those numbers are real. But can we precisely compare who saved more, surgeons or hygienists? For that, we need statistics showing how many lives surgeons saved on operating tables versus how many were saved by preventive measures that stop disease from happening. That kind of clean comparison doesn't exist. We know overall morbidity, we know the structure of losses, but we can't honestly reconstruct exact surgeon versus hygienist arithmetic. What else is confirmed? The existence of specialized services, their duties, and the logic behind creating them. We know the U.S. created a sanitary corps. We know the USSR introduced sanitary inspector, hygienist positions. We know their responsibility lists. We know these services dealt with water, food, housing, lice control, and organizing bathhouses. What stays gray? Real execution on the ground. Sources describe how it should work, but they show less of what happened in a specific unit on a specific day, during retreats or encirclements. We don't always know how strictly sanitary rules were enforced, how often commanders ignored them, or how often resources simply weren't there. Another gray area. What mattered more? Infrastructure or discipline? Water purification and bathhouses are infrastructure. Monitoring hand washing and underwear changes is discipline. Most likely both mattered, but sources usually don't separate the exact share of each factor. So the correct wording is this: prevention, organized as a service, reduced non-combat losses, and preserved Army's combat readiness. Whether it was more effective than surgeons' work is a question you can't answer precisely without comparable statistical series. But that prevention was critically important. That's not in doubt. Let's go back to the beginning. The military camp, the line at the water point, the kitchen, the latrine. There are no dramatic operations here. No last-second rescues on an operating table. Here you have the hygienist doctor checking water quality, watching kitchen cleanliness, monitoring the bathhouse, and insisting trash pits be covered on time. His work stays invisible as long as everything runs normally. But his work is what makes normal keep going. He doesn't treat, he prevents. He doesn't save the wounded, he stops the healthy from becoming the sick. He's an officer of systems, fighting for water, kitchens, and clean bivouacs. And by doing that, he keeps the unit intact. In the big wars of the 20th century, cleanliness stopped being about personal neatness and became a management technology. It was zakryplena organizationally. Services were created, positions introduced, regulations written. It was zakryplena through discipline. Hygiene became a duty, not a recommendation. It was zakryplena, technically. Water purification units, field bathhouses, and disinfection chambers appeared. Sanitation turned out to be part of military power, not a household detail, not a comfort issue, but one of the factors that determines whether an army can fight. And for that understanding to take hold, armies needed officer hygienists. People in uniform whose profession was making sure the army stayed healthy not only after battle, but before it too.